another MCQ today. So, if you find this video helpful, please like, share, and subscribe. Yeah, let's get to the question. A 38-year-old woman undergoes hysterectomy for symptomatic fibroids. The surgeon wishes to preserve ovarian hormonal function, which structure must be preserved to maintain the principal blood supply to the ovary. And the options are A. Round ligament, B. Ovarian ligament, C. Broad ligament, D. Infundibulopelvic ligament. Think, and if you think about any option, comment it. Here comes the answer. It is infundibulopelvic ligament. Let's see how it is answered. There are four options, right? Let's explore one by one. So first, let's get here to the broad ligament. This is double fold of peritoneum and it covers and supports uterus, fallopian tube, ovary, and its ligaments. So this is not a structure which is supporting anything. It's just a double layer fold of peritoneum. So it has subdivisions. It's very simple. If the broad ligament around uterus, we call it as mesometrium. And if it is around fallopian tube, we call it as mesosalpinx. And if it is around ovary, we call it as mesoovarium. So when we read about this, we found out there is no significant importance for this. Let's come back to the ovarian ligament. So the ovarian ligament function is connecting the ovary to the uterus. So this is where you see the ovarian ligament, and all this double fold of peritoneum is broad ligament. So this ovarian ligament connects ovary to the uterus. This is basically a fibromuscular band, and this is very important point. It does not contain ovarian vessels, and the main function of it is maintain ovary in its position. Yes, this is what about ovarian ligament we need information. Let's coming back to the infundibulopelvic ligament or suspensory ligament of the ovary. So this is this. This is nothing but this connects ovary to the lateral pelvic wall. So it's very important because it contains ovarian vessels like ovarian artery and vein and lymphatics and nerves. So through this ligament, there are ovarian vessels and nerves. So yeah, it's mean by blood supply to the ovary. So uh, and round ligament of the uterus here. This is nothing but it is attached to the cornu of the uterus and to the anterior one third of the labia majora. This has nothing to do with ovary here. So whenever you are a surgeon is performing hysterectomy, and if they have to preserve ovary, what things they have to keep in mind so that the blood supply and nerve supply gets to the ovary. Which ligament is giving its blood supply and nerve supply? It's infundibulopelvic ligament. That's why we retain it if we have to retain ovary in the hysterectomy surgery. So this is very simple. This is how you have to remember. So yeah, you can do a quick recall here. Another question based on the same concept is which ligament is a fibromuscular band that connects the ovary to the uterus and that does not contain ovarian vessels? We have just read here. That's ovarian ligament. So there you can have memory pearl here. Two ligaments for the ovary. One holds it, that is ovarian ligament, and the other feeds it, that is infundibulopelvic ligament. So we preserve the one that feeds it. So guys, if you find this video helpful, yeah, please hit the like and share and subscribe. Thank you.